Okay guys, we're going to look at gastric tubes again, but what I want to talk about right now is medication administration into a tube, gastric tube, or a drop-off tube. So right now our patient here has what we remember the name is Salem sump. We know that this tube's specifically for gastric decompression or suction. I've used this tube because my friend here, it's easier to get this one in. But keep in mind that if I'm going to give medications or a feeding, I'm likely going to use the drop-off tube. This is your view, okay, or the FlexiFlow feeding tube. But the first thing I want you to see is with either tube, the reason that we're at risk for aspiration is because sometimes this tube likes to inch up and come down and get stuck here in the trachea. That's what we don't want, okay? So I'm going to come around this side, and the first thing I want to do before I'm going to give medications to this patient is, of course, do my 6 rights, make sure I have the right drugs, and the right route is really important for this because I know that my patient is NPO, so I need to make sure that my medications can be crushed and delivered the appropriate way, or they're a capsule and they can be removed to go into my tube. If not, that would require a phone call to your physician to get a new formulary of that drug because we know that we cannot crush extended release tablets. So I want to make sure I have everything that I need. Most, like we discussed earlier, is that most medicines are going to be in the liquid formulary for this patient. So I've had that here. But the first thing I want to do is I want to assess placement. So like we did before, I'm going to do again. So with 30 milliliters of air, I'm going to put on my stethoscope and I'm going to place, so if I'm looking at this patient from the inside, we talked about where that, I can't even think where my process is, xiphoid process. It's been a long day, guys. Where my xiphoid process is my stomach there? Look at this patient's stomach. This is our stomach reservoir. So I probably need to go down about 2 inches from that xiphoid process. I'm going to palpate the xiphoid process, and then I'm going to move down another inch or 2 to actually listen with my stethoscope here and flush in my bubble. So I'm going to attach, and I'm going to listen. So I'm going to, there it is, okay? So I've assessed by auscultation, and then at that point, I'm going to aspirate residual. So I see that my patient has a little bit of gastric residual. This color can vary depending on what's inside your patient's stomach. So for example, this patient's not being given any feeding, so it's likely going to be that greeny brown bile color. So if I were to receive 36 milliliters, I'm going to give that back to my patient, and I'm going to clamp the tube off with their clamp if I had one. I don't have one. And I'm going to let that sit so I can prepare my medications. If I were to leave that open, what would be draining everywhere? Let's set that in there. Okay. So now I'm going to prepare the medicines that are ordered for my patient. Well, I don't have a pill crusher today, but I'm going to talk about how you dilute medications because we know if we were to crush this tablet, this would just be a crushed pill in my cup. So the standards for you to know for NCLEX are that every pill, every non-liquid medication that you're going to give in a tube must be diluted with 5 mLs of water. Okay? So you're going to crush 1 pill, crushed, and you're going to add 5 milliliters of water to dilute that. Some people like to get a spoon, or you can use the tip, because is the stomach a sterile environment? No, it is not. And we're going to use what kind of water for a patient? Tap water, bottled water, not saline. Okay, sterile water is appropriate as well, but we can use tap water for patients. So for every medication that I plan to give my patient, I need to dilute with 5 milliliters. Now, on your nursing units, you may see nurses crush all 6 pills and put into 1 cup and add water to it. That is not NCLEX appropriate knowledge. I say that we need to do it the correct way and do 1 pill at a time. If there are no contraindications for each medicine and you dilute with the appropriate amount, so if you gave 5 pills, how much water would that be? 5, 10, 15, 20, 25 milliliters of water would need to be in this cup with those 5 crushed pills, if they were all compatible and could all be crushed together. My knowledge to me says they're all going to the same place anyway to be absorbed, but let's be clear, if there's a medicine that does not need to interact or absorb with another one, then you need to space those out appropriately. NCLEX says we need to do those separately, just so you know. Most nurses on most units are not going to do it that way. But we're going to learn to test that way, correct? Okay. So, tablet 5. Then I'm going to take my plunger out, like we've already seen. I'm going to scoop and clamp my tube so that air is not entering my patient's stomach and gastric contents are not pouring out onto me. I'm going to place here, and now I'm going to go ahead and give my patient the 5 milliliters with that med. And then I'm supposed to flush with 10 milliliters behind that 5. My second medicine with 5 milliliters, and keep in mind, how much have I given already? So we've got to keep up with how many milliliters that we're giving each patient. Then when I'm finished, we know that after any med administration, we need to flush with 30 milliliters of water to flush our line out to make sure that all that gets into the stomach and can be absorbed and digested well. And you see how I'm holding it up? When I hold my syringe up, that allows gravity to allow that to get down to my stomach. And then I come back and clamp it here. The purpose for that is that I'm not letting all that air go down into my stomach, okay? A patient's stomach. All right, so then I'm ready to clamp them off. Let's say this patient was connected to suction and they were starting to allow him to get medicines through his tube. It would not be appropriate to immediately hook him back to suction because you just gave him all those good meds that he needs. So typically speaking, 30 minutes to an hour after medication administration for any Salem sump compression tube must be removed off of suction for 30 minutes to an hour. That's to allow those medications to absorb, work, digest, then we can place the patient back on suction. Okay? It's important to note, the reason that you want to assess placement is because what if our tube really was right here and we did not assess for auscultation or aspiration of gastric contents, and we decided to give 60 milliliters of medication and flush. Where's that going to go? What is this? A lung, okay? So it's important that, it's gravely important that we assess for placement. And if we're ever concerned by our assessment methods, which is the auscultation and aspiration, it's always appropriate, like we said, to get a x-ray, notifies the physician that it's a standard order. It's called a protocol, a gastric tube protocol, that you can do a bedside x-ray to confirm line placement, tube placement at that point. So most of the time when you're going to be doing medications, you're going to need to have water, a clean cup, your 60 ml syringe, a pill crusher if necessary, and for your capsule, just go ahead and show you that. For your capsule, as long as it's not an extended release, and the reason is because this needs to dissolve in the gut as well for an extended release, you open the capsule up with gloved hands, obviously, and you're going to empty that powder into your cup, and then add your 5 milliliters of water. I had my cup over here. Okay, so you're going to add your 5 milliliters of water to allow that powder to dissolve, because we can't just go put powder into his tube. It's not going to go anywhere, is it? You always have to have your water to dissolve it to allow it to get to where it needs to go. But that would be appropriate for your capsules. Then you would use your pill crusher for your pills, and you would do water with each. So the standard is 30 milliliter flush before any med administration or feeding, 5 milliliters with each crushed tablet or capsule, and then follow with that 30 milliliters of water. So regardless of how many pills you give, you're going to do a 60 milliliter water total flush with those medicines. So let's remember those things as we move forward. Okay.